Good morning, all. Am I audible? Great. Good morning. So we are starting our reading club with the prayer.
भेद भाव अपने दिल से साफ कर सके, दोस्तों से भूल हो तो माफ कर सके, झूठ से बचे रहे, सच कदम भरे, खुद को जय करे, हमको मन की शक्ति देना, मुश्किलें पड़े तो हम पर हित न कर्म कर, साथ दे तो धर्म का, चले तो धर्म पर, खुद पे हौसला रहे, बदी से ना डरे, दूसरों की जय से पहले खुद को जय करे, हमको मन की शक्ति देना।
Good morning. We are giving tribute to our great master Samuel Hahnemann for this wonderful divine science to all of us and taught us dare to be wise. Seeking blessings from our Guru, Dr. Prafull Vijayakar sir, who have made this divine science with a modern science understanding and made it homeopathy like mathematics. Jai Hanuman, Jai Homeopathy, Om Vijaykaraya Namah. So friends, we are in the journey of reading organon practical part along with the sir's book Verbatim, the workshop conducted in 2002 by Dr. Prafull Vijayakar sir. So up till now in organon we have read 99 aphorisms. In the last aphorism we have read that whenever we are inquiring into acute cases, then every symptoms is the striking and that gives a PQRS to the physicians. So much less time is needed to inquire into it if it is an individual acute disease. But another variant of individual another variant of the acute disease, which we called as the epidemic or sporadic disease, then what to do? So the wisdom of Master Hanuman telling us about certain idea. Then when you came across this kind of disease, what should you have to do in this case? So in investigating the totality of the symptoms of epidemic and sporadic disease, it is quite immaterial whether or not something similar has ever appeared in the world before under the same name or any other name. The novelty or a peculiarity of the disease of that kind makes no difference either in the mode of examining or of treating it, as the physician must anyway regard the pure picture of every prevailing disease as if it were something new and unknown, and investigate it thoroughly for itself. If he desired to practice medicine in a real and medical manner, never substituting conjecture for actual observations, never taking for granted that the case of the disease before him is already or partially known, but always carefully examining it in its all phases, and this mode of procedure is all the more requisite in such cases, as careful examination will show that every prevailing disease is in many respects a phenomenon of the unique character, differing vastly from all the previous epidemics to which certain names have been falsely applied, with the exception of those epidemics resulting from the contagious principle that always remain the same, such as smallpox, measles, etc. So, in this aphorism, what Master is telling that if you know the name of the disease, don't go behind the disease, and you have to find out that everything is if you want to treat that disease, you need to make a pure picture of the disease from the cases, not by the name of the disease. So this is what we have to do. Again, we have seen that the epidemic of COVID. So in the COVID, what sir has proposed, Dr. Vijayakar sir has proposed that whenever you are treating the COVID cases, so there must be a three categories: the mild categories, the moderate categories, and the severe categories of the disease. And in all these three phases, there is a symptom totality is different, and according to that totality, the remedy also different. So what Vijayakar sir has proposed that in early cases or a mild cases when the patient has lost the smell and lost the taste, at that time the remedy prescribed was the sepia, and then another category where the blood become thick, the oxygenations become reduced, and the saturation goes down. In these cases, sir has advised that you should prescribe the ophidia in the second or moderate categories of cases. And when the it goes into a severe cases, when the patient was in the suicidal mode or patient goes into the death bed, or on the ventilator, at that time a different kind of medicine to be prescribed. So this is what something you have to treat the epidemic with the phases where you have to be observe each and everything what is happening inside the case. So what Master Hahnemann telling in 101, it may easily happen that the first case of epidemic disease that present itself to us, means to the physician, notice he does not at once obtain a knowledge of its complete picture, as it is only by a close observation of the several cases of every such collective disease that he can become conversant with the totality of its sign and symptom. So whenever the first symptoms appear, we cannot get what is the actual COVID is. But after understanding the several cases, then we can get that the COVID has a three categories: the mild, moderate, and severe. So on the basis of that, the collective symptoms, then the totality has been made, and the sign and symptoms. So symptoms is a loss of taste and smell. It indicates that the COVID has arrived, but the sign that there is oxygenation has been reduced. So this is what something that the lung has involvement. So this has to be taken into consideration. So the carefully observing physicians, however, can form the examinations of even a first and second patient often arrives so nearly at the knowledge of the true state as to have in his mind a characteristic portrait of it. So that is what a characteristic portrait of whole disease, and even to succeed in finding a suitable homeopathic adapted remedy for it. So this is what Dr. Vijayakar sir has done during the phase of COVID. In course of writing down the symptoms of several cases of this kind, the sketch of the disease picture become even more and more complete. So whenever we are writing down or we are treating many cases, so the sketch of the disease become more clear, not more spun out and verbose, but more significant, the more characteristic, and including more of the peculiarity of this collective disease. On one hand, the general symptom, the loss of appetite, sleeplessness, etc., become precisely defined as to their peculiarities, and on the other, the more marked special symptoms which are peculiar to but a few diseases and of a rather rarer occurrence, at least in the same complete combination, become prominent and constitute what is characteristic of this malady. So this is something you have to keep in mind whenever you came across the epidemics of a different disease. Say, for example, it was COVID in our era. In the 1920, there was also a flu, and that flu is a different kind of flu. We came across a different flus like a swine flu, bird flus, and everything. So this is something you have to keep in mind for this disease. So collective symptoms of all the diseases become more and more complex, and it forms a peculiarities in each and every case. So physician who has already in the first cases been able to choose a remedy approximating to the homeopathic specific will form the subsequent cases be enabled either to verify the suitableness of the medicine chosen or to discover a more appropriate, the most appropriate homeopathic remedy. So in COVID era also there are different kind of medicines to be chosen according to the knowledge of the physicians, but after giving that medicine, how the response has been happening. So the sepia work wonder in mild cases, the ophidia work wonder in the moderate cases. So that is what, if it is not working, then the more specific, more appropriate remedy to be find out in the cases. So that has to be taken into consideration. So this is what the case when we came across the epidemic or the sporadic disease. So now we are reading the workshop 2002 Mahabaleshwar conducted by Dr. Vijayakar sir, and this is the verbatim. It is the script of that workshop. So we will continue our reading of this. So up till now we have learned the cases, and in the yesterday's session we have understood that how to approach the one-sided disease when they came across to us with a paucity of symptoms. So the continuation of this, Dr. Vijayakar has started it, the chapter 17, chapter 14. So we saw today through the Dr. Anita's case how our predictive group members are getting fantastic results not only in the pathological cases but also the mental pathological cases. These are the one of the most difficult cases for a homeopath. A homeopath is supposed to treat at the level of mind. But when mind become worse, the homeopath has become also worse and he cannot treat. So this is what the things we have. So the differential approach which we are propagating is consistent with the teaching of Master Hahnemann in Organon. So Hahnemann, as mentioned, the way of prescribing not only once but 2 to 4 times in the whole of Organon, we have not been reading it carefully and not assimilating it. Leave aside applying it. He mentions the adaptations of the knowledge of the disease, adaptation of the knowledge of the remedy, what they can cure to that of the disease, and this is exactly what we are showing you one by one. We have shown you ordinary psoric cases, Dr. Suchira's case going from psora to psychotic, the Frank's Villadic case, retinal detachment, and I have shown you today the genetic abnormalities or irreversible pathology being controlled. Today we saw the sixth and seventh layer disease, the highest level, which Dr. Anita demonstrated very well, As the disease go from one layer to another and as it shifts its gear from sora to psychosis, it becomes more and more unmanageable. Homeopath of yesteryears, barring a few, shows a result in psoriatic disease in the lowermost layer. They are showing result in rhinitis, eczema, asthma, or constipation. These are not the disease to be shown in the seminar. When the disease shifts gear and goes to the psychosis like a hypertension, cyst, tumor, atherosclerosis, many homeopaths fails in a serious and a grave disease. They get result in cough, cold, and fever because though the law is universal, the application of this law is not universal. They have never understood what homeopathy is. This is what we are trying to demonstrate. Here, Dr. Anita took exactly the syphilitic rubric. So it was the conclusions of the yesterday's sessions. So here, Dr. Anita took exactly the syphilitic rubrics, and that is what had made the difference. She first went wrong because of the wrong applications of the law, but when she understood that here I am going wrong and I have to pick up the syphilitic rubric, she went right. So this is what we also do in our practice, wrong practice, and then we understood that we have not chosen a syphilitic pictures of the patient, and then we when we apply that, then we get the result. It has to be very clear in our mind what is psoriatic disease, what is psychotic, and what is syphilitic disease. What are the psoriatic, psychotic, and syphilitic rubric? So this is what we have to keep in mind and learning. So to the newcomers, I must advise that you go through the repertory, read the rubric, and understand the rubric in the form of miasm so that you can understand whenever the case come to you. According to that miasm, you have to choose the rubric, and then your surety of the result is increasing day by day. As the disease goes on getting suppressed, side by side, even a mind is affected. So mind is diseased later on. You just get the emotional disturbances, the anger, irritability, despair. This is the defensive mechanism is always there. This is not disease, it is its reaction depending upon the miasm. In higher level, as in cancer, the disease which is here changes sides and the disease instead of being physical goes to the mental sphere. As Dr. Hahnemann has called it, it is one-sided disease. The corporeal manifestation of the disease is gone or transferred into the mind, the destruction of the mind as we saw today in Anita's case. This is the destruction. So we have to take destructive rubric, not conscientious or timidity unless and until the consciousness which is exhibited has gone out of control. So in that case also we have to understand. Work, work, and only work, the excessive work, the case, yesterday's case. So a workaholic trying to work and earn money is psychotic. When he is diligent, he is sorry. When he become mad after work, he is destroying himself by working, and that is the syphilitic. He has gone into the syphilitic sphere. Similarly, mind also after some shock, anger, or a grief can change gear and go into the seventh layer, the destructive layer of the body. So this is my additions. Maybe if Hanuman had lived, he would have added to it. This transitions from mental to the physical, then gives rise to the one-sided physical disease like a cancer, motor neuron disease, and the disease which do not show symptoms at all, etc. So it is not only transfer from the physical to the mental, but can also be other way around. So sudden loss of a child and the patient is shocked and she goes into this one-sided disease, provided the patient is of a psychosyphilitic constitution and not the psoriatic. So this is also very important. So in aphorism number 31, it is something which was written that the obnoxious agent, partly psychical and partly physical, unless and until it is affecting the individual, if the individual is susceptible to that. So that means if the constitution is psychosyphilitic and he goes with the shock or ailment in their life, he develops a disease. If the constitution is psoric, he develops a psoric disease. If the constitution is psychosyphilitic, he develops maybe a one-sided disease, maybe a cancer, or maybe a motor neuron disease. Maybe this could be a reason. So the shock. Shock is the emotion, but that emotion produces a disease when the miasm is lurking inside the constitutions is giving you a type of a disease. If the psoric, then the psoric disease is psychotic, you develop a psychosis, and if it is a syphilitic constitution, you develop a syphilitic defense. So I'm taking of the aphorism number 211 where Hanuman has talked about the one-sided disease. I want to quote that corporate sorry, that corporeal disease now no more exist, as in insanity, etc. It is the opposite in 225. If this is true, the exact opposite is also true. It is like an electron and negative particles. The scientists were so sure that nothing similar could coexist. There has to be two things. One is negative, one is positive for anything to exist. So only electron can be possible, and there has to be something like a positron also, which we do not know. Very lately, only 1 month back, scientists have said that the positron does exist, and they feel it is the building block of the abstract world. There has to be a mirror image reflections also. So in cancer and malignancy, there are certain people who are so anxious, oh my God, cancer. But when cancer actually develops, they are without the emotion. It is okay. You can call it resignations or anything. So this is something that you have to keep in mind. This is understanding of the. There are certain cancer which are not at all detected. So there are mental disease which can go to the physical and vice versa and destroy the other state. So anxiety can destroy the physical state. We always follow the Panchatattva, the mind, body, thermal thrust, and the physical, which are all governed by the miasm. So the concept of the man is made up of the Panch Tattva or Panch Mahabhuta. The Panch Mahabhuta is consist of the air, fire, water, energy, and earth. So air represents the mental quality, the mental makeup. The fire representing the thermal quality of the person. The water representing the thirst and thirstlessness. The energy represent the activity of the person, and the earth represent the physical aspect of the human, which include the structures, disease, and tolerance, etc. If even one is left out, any of it, then suppressions or failure occur. So we have to take into considerations everything. So take a strong. So what we have to do in our practice? Take a strong mentals and combine it with the strong generals and differentiate remedy with your knowledge of materia medica. Eliminate with the thermal and thirst. All you have to do is to find out will, intellect, moral conscience, and the speed of the patient. So this is what the approach in each and every cases. So in yesterday's cases, we have shown that the quality of the arsenic patient as well as the quality of the sulfur patient in the schizophrenic cases. So on the basis of that, we find out and the thermal has to be matched with there is a matching with the arsenic, but the thermal is hot. So the prescription of the remedy is sulflavum. So same way what sir has said that you have to take into consideration the strong mental rubric, then combine with the strong generals and differentiate remedy with your knowledge of materia medica, eliminate with the thermal and thirst, and all you have to do to find out the will, intellect, moral, and the speed. Speed of the patient can be of the speed of the disease, speed of the person, speed in his behavior. So this has to be taken into consideration. Certain disease is growing rapidly or going fast. So some of the remedy which we have, that is the Naxomica, arsenic, ophidia, are the fast remedy, whereas some disease which is progressing slowly by the years, long standing. So this is the speed of the disease also decide the speed of the constitution. So in a slow progressive disease, so remedy like Kilkiria, Baraita are the slow remedy. So that has to be counted into considerations. It is not necessary that everything has to be represented. Then find out the thermal and thirst and one or two very strong mentals. You will came to only 4 5 remedies. So this is what Sir's way of understanding the disease as well as the man. So find out some strong rubrics, strong mental rubrics, either from the general class or either from the particular class of mental, strong mentals, and then add thermal thrust. So your remedy, the selection of the remedy is in a very narrow range of 4 5 remedy. They have to be picked up according to the disease. So again, add the sphere of actions of that remedy into a case. So this also guides us that some remedy has a specific action on particular area, that is called sphere of action, so that you have to consider more. For example, aurum and nasa is the one of the great remedy for the heart affection. So whenever you came across some congenital heart disorders or the heart disorders in the patient or a valvular disease of the heart, whenever you are entering into rubric and you find a nasa and aurum, so you have to take into consideration that this both remedy has sphere of actions on the heart, so eliminating other remedy and including this remedy into your totality. So that has to be taken into consideration. You have to develop that tact. So this is what sir is always telling you have to develop this technique. First of all, you have to know the soric, psychotic, or syphilitic rubric. So this is what you have to do exercise at your home. That you go to the repertory, read the rubric, understand the meaning, and then you have to categorize it. It is a soric rubric, psychotic rubric, or a syphilitic rubric. So that has to be taken into consideration. If you have understood that the syphilitic is out of control, something disgusting, weird, and if you have understood the psychosis, excess, and psychosis shallow, and the soric irritability, anxiety, inhibition, then you can pick up the rubric easily. So this is what the sir put more emphasis is on miasm, because this miasm gives you an idea that what should be taken into consideration for the case. If you have a huge long case, the longer the case, more the confusion. So, sir always says more knowledge, more confusion. So that is what you have to understand. So if you have a huge long case, the first requirement is to know is how this person's behave in circumstances throughout his life. So this is what behavior of the patient. If you know that he has behaved in a timid manner everywhere, you can take timidity as general rubric. If he have been very regular in his work, then you can get conscientious as the general rubric. You are reducing them. The selections of your rubric should be on the basis of miasm. Understand the miasm from the disease that has come in either mental or physical level. For example, take syphilitic characteristic in syphilitic case. So something you have to understand that very important. So if you have a case of syphilis, a syphilitic case, and you are taking a soric rubric like a anxiety and everything, it is not going to help you. Okay. But the soric sensitivity in syphilitic cases that help you that this sensitivity can lead to the syphilitic disorder, then it will guide you that you can enter into the case. Let us read this aphorism which mentions exactly what I want to say. In aphorism number 216, the cases are not rare in which a so-called corporeal disease that threaten to be fatal, a suppuration of the lung or the deterioration of some other important viscous or some other disease of acute character, for example, in childbed, etc., become transformed into insanity, into a kind of melancholia, or into mania by rapid increase of psychical symptoms that were previously present, whereupon the corporeal symptom loses all their danger, and this latter improve almost to the perfect health, or rather they decrease to such a degree that their obscure presence can only be detected by the observation of the physician gifted with perseverance and penetrations. So you have to understand that how the corporeal disease transform to the mental disease. In this manner, they become transformed into one-sidedness and as it were a local disease in which the symptoms of the mental disturbances, which was at first but slight, increase so as to be the chief symptoms and in a great measure occupies the place of other, that is the corporeal or bodily disease symptoms, whose intensity is subdued in a palliative manner, so that in a short the affections of the grosser corporeal organ become as it were transferred and conducted to the almost spiritual, mental, and emotional organs, which the anatomist has never yet and never will reach with his scalpel. So this is what Master Hahnemann has given in the in the aphorism number 116. 216. So what Dr. Prafull Vijayakar says, so what is the advantage of this approach? How has this helped me? The advantage of taking a miasmatic representative from the mind and body combined with the thermal is that I do not become a prejudiced observer and understander of the materia medica, which has been hitherto supplied to the us. Not all materia medica books show the same mental picture of the remedy. There are so many different types of pictures of the remedy which are not given in any materia medica. So many times the triamiasmic remedies are represented as one or two types of the miasm, never all three. So how to differentiate it? This type help us to come at the correct remedy at the right drug picture so that the corresponding physical or mental disease can be cured. So if opium is sluggish and psychotic, it may be very active and syphilitic. Last year I showed you a case of aurum. It never looked like aurum because it was a hysterical. So it was a syphilitic aurum. So sometimes you have to understand the remedy by the repertorial perspective. That means you have to read the rubric, reverse repertory, read the rubrics of the every remedy, and then you make a totality that this is the syphilitic aspect of this remedy, this is the psychotic aspect of this remedy, this is the soric aspect of this remedy. As we have learned a case of a PCOD in which the female is going to the breastness and libertine and everything. So on the basis of that, you can think of different remedies. But when I took a totality and on the basis of I prescribed the pulsatilla, as you have seen, it was in the first month of our study of reading club. So you can go through this in our one of the YouTube video. I don't remember in which class I had taken that case, but it was taken. So this is what you have to take into consideration. This is the syphilitic pulsatilla. The syphilitic pulsatilla become a very courageous. Syphilitic pulsatilla become a very rashness, very impetuous, bold, or a libertine pulsatilla. So this is something you have to take into considerations as the case is. So there was nothing like a industrious or duty conscious in hysterical aurum, which is the soric aurum would be having. In course of these days, we will try to give you a different setup. You should be able to form your own materia medica. So this is what we have to take a materia medica from the repertorial point. We are starting with the case. The Mr. A's 5 years male child came in with the chief complaint of the weakness in the leg and calf muscles while walking since 3 4 months, pain in the leg since 6 to 8 months. He has taken allopathic treatment. This has started 1 year back. He wants his mother to lift him up while walking. With this history, always think of DMD, frequent muscular dystrophy. His mother complaint was that of constipation. Has to strain a lot, stool once in 2 to 3 days, has to be removed mechanically. He also had recurrent running nose, irritation, cough, and vomiting while coughing, aggravated from the change of weather, strong odor. Personal history, appetite poor, craving for the hot food, chocolate, ice cream, thirst normal, perspiration plus around the head, dripping in AC, thermal hot, sun, aversion. Now the nature of the patients. The patient is very sensitive, get hurts very easily. If there is only one piece of bread and mother give it to him and not the elder sister, he feels bad and give his own piece to his sister. If mother give a piece of bread to someone and that person throw it, he feels bad, he scold and beat the opposite person in anger. So this is what the emotions of the child is, a 5 years child. You have to deduce from the incidents what are the natural traits that child is showing up. He is feeling hurt that mother has been insulted and the reaction is going into anger. If he has 2 pieces of bread and nothing is given to his pet dog, he will give his share to his pet dog. So again, you can think of that this child is very sympathetic. Sensitive to noise and the crackers, but loves music, fear of a giant wheel, not because of motion, but he gets frightened. He is very frightened when it reaches the top, when it is climbing the height. This is what frightful constitution. When angry, will beat and bite his sisters. Back answer his grandfather's grandmother, and father does not like his father, say he is a splinter. So how 5 years old child is talking like this? Play alone, shy and timid outside and obstinate at home, otherwise obedient. He is interested and very particular about his studies, intelligent and conscientious. In school, he is a good obedient and consistent child, inquisitive in nature, he is very careful while crossing the road. He is always well dressed, full shirt and full pant, always keep his books and clothes in a proper place and is tidy. Try to behave like a mature man. So this is something always precocious. Does not like anyone touching his books, does not misplace his things. Though religious, he does not like to pray to the god or put tikka on the head. Destructiveness of his toys. He is very much possessive about his things, crazy about cars, speed is fast, very restless and very attached to mother. Very sensitive about the animals, cannot see cruelty and the blood, cannot see animal or humans in the pain, loves animals and playing on the computers, is very creative, artistic, and has won many prizes in drawing and painting. So these are the trait of the person, a very sensitive to the insult, angry child, then the sympathetic towards the animals, then the behavior is different. We say the father is a splinter, the shy, timid at home, but outside, shy, timid at outside, but at home he becomes very obstinate, very careful and cautious child. He likes to be a mature like a man, so this is a precocious child, very destructive of the toys, and the speed is fast and creative and artistic. Now, birth history. The full-term vacuum delivery with the episiotomy, even during the birth, the child is giving his miasm. This is a psychosyphilitic. So, even mother has passed through this, is something called as psychosyphilitic. Vacuum delivery means what? The child has not come out. So this is something psychosis less. And episiotomy, that means they put the cut so that the child came out. So this is the psychosyphilitic. During on the third day of the birth was given 3 injections of the biotox 125 milligram 3 times a day for 5 days. So this is what something that at the third day he developed a fever and he was given an injection. The mother history, the history of asthma during pregnancy was treated by the allopathic treatment. So analysis. Now, what is the analysis of the child? So you have this kind of the child having a weakness in the legs and he wants mother to hold me. Okay. So the diagnosis can be a duchenne muscular dystrophy. For that confirmation, we have to go on through some investigation. So now, child has come with the pain in the leg. The investigation come into the hospital. The CPK was done. Why was this done? When the child start complaining of pain in leg, the first thing that is done is CPK. There is strong doubt towards the DMD. It is a genetic abnormality that is found usually in males. The child start complaining of the cramp while walking or ascending. The first sign is the pain and the cramp. So this is something which we call as a psoric symptoms. The disease goes from outside in and below upward, the opposite to the Herring's law. The short arm of the gene 19 is affected. This gene has a code which get depressed on at the age 3 to 4 years. It starts synthesizing a protein which destroy the dystrophin. So DMD starts with this is the pathophysiology of DMD. Destroy the dystrophin, which is there to protect the muscles. So the protection of the muscles is gone. They do not have the inflammatory psoric tendency. They start becoming psychotic. So that is thickening, hardening. So this is what the calf becomes so large. So there is no first defense or sora. And finally the muscles start degenerating. So that is a CPK level rises. It is a destruction of the muscle started. So degeneration giving rise to excessive CPK level. This is known as pseudo hypertrophy and complete degeneration. And the muscles grow unnaturally. So weight of this protein is 427 kd. So this particular genes get depressed. If this is not depressed from 4 to 12 years, my experience that we cannot cure, but avoid these abnormalities. I have seen 4 cases where this definite trait was there, but the disease is not developed. So how did the disease reach this layer? We need to find out. So journey of the disease. So he had a recurrent cold and coryza, the third layer, ectoderm sora, still much inflammatory. He developed a diarrhea, vomiting, coughing while so still in the endoderm, the sora. Then mesoderm, pain in the leg, still it is a sora. Then swelling of the calf muscles, the mesoderm, psychosyphilitic, and weakness of the leg, means psychotic and syphilitic. So inflammation goes into destructions, syphilitic. When such patient comes, the disease is neither purely soric or purely psychotic nor purely syphilitic. All three miasms are there. The miasm get affected one by one. Gradually, the process of inflammation goes into a process of swelling, goes into a process of destruction is going on in the body. So this is what something that all three miasms are there. Now let us go to the mental. Let us see the different trait that mother has told us. So all are requested to take this as the process. You have to take the history in one page and write down in the second page or in the box that this is something that is the rubric. This is something that is the rubric. So here what is the deduce from the history that gets hurts very fast, so he is very sensitive to rudeness or offended easily. Mother give piece of bread to someone and that person throw it, he feels bad, so he is injustice, he has a sensitivity to injustice, cannot support. Scold and beat the opposite person, beat the bite, beats bite the sister. He is not a mild child, so anger, violent and sensitive, cannot see cruelty in the blood, cannot see animal or human in the pain, love animals, he feels bad for others, for his mom if someone throws that food. So sensitive, oversensitive, sympathetic towards especially the animal. So sensitive to noise and crackers but loves the music. So here sensitive to music and sensitive to noise. Fear of a giant wheel, not because of the motions. He is very frightened when it reaches the top. So fear of height, back answer his grandfather, grandmother, father, and he says he does not like his father, says the father is a splinter. This is something that impolite behavior. So it is a rudeness or insolent behavior. Plays alone, that is a reserve kind of person. He is very careful and crossing the road, so cautious, very intelligent and particular about studies and wants everything in a tidy. So this is what conscientiousness, always well dressed, full pant, full shirt, tries to behave like a mature man with a precocity, wants clothes and books in a proper place, does not misplace things, does not like other touching his book, does not like anyone disturbing it. He is not selfish. If he have been very selfish, he would not have been sharing his bread also. So this is what something we have to deduce from the case. So the fastidiousness, love drawing, has won a lot of pride, so artistic aptitude, crazy about the car, which children are crazy about the car, those who like to wander to or travel that are there is some tubercular diseases. So most of tubercular diseases who love the car. Also speed is the fast. Such children are restless, so it is better that we take the bigger rubric than the limited rubric travel desire for. So it is what the general trait deduced from this is the restlessness. Attached to mother, but if he was very much motherly child, then he would not been shouting at his mother. So I would not give much importance to this. Also at this age, everybody is attached to 5 years old child attached to mother. So this is what we get the whole the sorrow psychotic syphilitic pictures of the case. And now, on the basis of this precocity, fastidious, artistic, restless, conscientious, reserved, sensitive to rudeness, insolent, sensitive to music, and sympathy towards animal, injustice cannot tolerate, anger, sensitive, violent. So, what remedy comes into your mind from this only? Yes, carcinogen, absolutely. So we are just trying to understand what we have got from this history in the language of the repertory. They are not rubrics for repertorization. This is just an exercise to set our brain functioning because translating the word of the patient into repertorial language is the biggest hurdle. And I always take it as a first value instead of building up hypotheses. When proving were done and written down, it was clearly what they got. So why should we do hypothesis? We are getting result without this hypothesis. Now the first is the full term vacuum delivery with the episiotomy. Even during birth, the child is giving out his miasmatic influence. This is the psychosyphilitic trend. Do not take this as a torpor, obstinacy, timidity, appear in public, or desire to be at home. So this one small incident can give you so many dangerous rubric. This is what the metaphorical understanding of this vacuum delivery with the episiotomy. That is what you have to metaphor. So you get this type of rubrics. A question was asked to me, does a pregnant lady have one vital force or a two? The answer is one. The physical gender, she has a craving for chocolate, ice cream, copious perspirations over the head, tendency to constipation. So the miasm, all three miasms are there, psoro, psychosis, and syphilitic, which are the rubrics that you will take. We have to take all rubrics. Sora in deacon musculoskeletal never ends. It is not only the psychosyphilitic. All three miasms are going on. The inflammatory tendency is bound to go up from below. In DMD, inflammation is never over. It is always going on. So very important to treat this. Inflammation, pseudohypertrophy, and destruction, all three are there. So in DMD, everything are there. Sound is harmony in music. He also keep his book close in harmony. He is a fastidious. Love for music is small rubric which is dangerous to take. So we take the sensitive to music. So this is what the generalizations. Sensitive to music. On repertorization, we get only one remedy going through and through, that is carcinosin. It covering even the physicals. So this is surprising. We never knew carcinosin was so violent. It also covered the rudeness in children. We always think of carcinosin as such a sweet child. This child has a soric, psychotic, and syphilitic symptoms in him. Even cruelty, humanity, the way he goes and bites his sister, this is again the syphilitic aspect of carcinoma. It is not only biting, he beats and bites. As his disease will go more towards syphilitic and he become more and more disabled. His rudeness and cruelty will increases. So his syphilitic miasm is in progress. So remedy given was carcinosin, 201 dose on December 2001. Follow up 10 days after. Within 11 days, appetite was much better, weakness and the pain in leg was also better. After 4 months, the child suffered from the chicken pox and the throat pain. Now, what is this? Why did the chicken pox comes up? Is it a good or bad sign? It was diagnosed by a physician in his native place. Chickenpox is a tumor virus like HSV, EBV, Epstein-Barr virus, herpes simplex virus, and cytomegalovirus. HSV in a children gives rise to chickenpox in an adult. Why are they known as a tumor virus in the allopathic world? Because when they infect and go into the cell, they causes change in the mitotic cycles in such a manner that the extra growth occur in the cell. The cells start growing excessively, giving rise to the tumor. For us, it is a psychotic virus. For us, it is the psychotic virus. This tumor virus, when thrown into the skin to clear the internal malady or dysfunction, this is called a exteriorization. So I was treating a case of malignancy. This is another case of malignancy where metastasis disappear and the patient develop herpes on the body, and the idiotic oncologist asked her to treat the herpes first by an antiviral drug. Despite my advising him, his wife not to do so, I told her, if you do so, this man appearing very healthy will die within 2 months. He died within 1.5 months of suppression of the herpes. Once this damage is done again, you cannot repair it. At least I could not repair it. So this is what sirs has said that in Sir's clinical practice, Sir has shown these cases. So I have lost a couple of cases like this. So just rejoice and lay your hands off if tumor virus appear. So in whenever you are treating any deep cases and the virus comes out, so that is the welcome signs and do not allow to suppress it. So this is something you have to keep in mind. So virus is in neuroectoderm and it is thrown off on the ectoderm. This is an excellent sign. This virus, especially tumor virus harboring in the nerve or muscles, are thrown off on the ectoderm through the procaudal plate. So the patient will first get some throat problem and then on the body. So tumor virus being exteriorized in is one of the best result for a homeopath. This is what keep in mind. Follow up in a June. The child developed vomiting, was again given a cell. Do not repeat the remedy as he has a past history of vomiting after chickenpox. He never complained of the pain at all. He is active, running, jumping. Previously, he wants mother to carry him, but now he is running, jumping, and everything. So that represents that the destruction has been hold up. They went to a place in Kerala where the child climbed up last 1 month and he has been running around upstairs and downstairs. Within 1 month of treatment, the pain completely disappeared. So, what do we learn from this case? There is a time frame for this disease to develop. These children never suffer at the age of 1 and 2 years. This is because to develop a psychosis, it takes some time. So recurrent suppressions of the psoric complaint like a cold, cough, vomiting changes the defense to the psychotic and then the process of repressions and depressions of the gene starts. Such children with this trait, if taken to homeopath before any suppressions of the psoric disease, then this child will not go from psora to psychosis and if we can carry him safely from 4 to 8 years, then we can very well avoid this genetic disease. I have a child who came to me when he was 3 years old and today he is 13. There are seven in the family in his family with the DMD. This child was destined to die of a DMD, but today he is absolutely fine. So we must prevent the suppressions or changing of the gear from first to second layer or a miasm. We can still prevent the miasmatic or rather genetic disease. So this is what how far the sir has gone. So our medicine can prevent the genetic or miasmatic disease also. We also learned that during the cure of any psoriatic disease, throwing out of the tumor virus is essential or welcome. So, in regards to this, we can still prevent the miasmatic and rather a genetic disease. In regard to this, also the olden physicians also write that even a Clark has written that whenever the mother has given a previous hydrocephalic children, and if you give this to a mother during pregnancy, then the child born without the hydrocephalus. So this is what one of the experience of one of my colleague doctor, Dr. Vijay Krishna from the Bangalore, and he shared one case that a patient came with the previous history of 4 5 hydrocephalic child during pregnancy, and she was aborted that, and after that. He knows that it was written in the class that there is a it prevent the hydrocephalus. The remedy is calcarea phos. Yes, absolutely. The remedy is calcarea phos. So he prescribed a remedy to that lady, and after that. She got pregnant. She got pregnant during pregnancy. He also repeated once or twice the calcarea phos, and the all the sonography became normal and she developed a normal baby, and now that girl was almost around more than 20 years. So this was the case 20 years back. So this is something that you have to think that our medicine can prevent the genetic disease also, prevent the miasmatic disease also. So this is something that is the clinical experience of one of my friend, Dr. Vijay Krishna from Bangalore. So we also learned that during the cure of any psychotic disease, the throwing of the tumor virus is essential or welcome. When we understand the pathology which we are treating in terms of defense of psora, psychosis, or syphilis, and take rubric accordingly. That remedy has to be right followed by cure. Dr. Kent has said that having arrived at the remedy, the name of the disease is immaterial. But if you look back, you will find that the remedy will cover the disease as well. If your remedy is right, it covers the patient as a whole, and that is called mathematics. So this is something you have to take into consideration. If your remedy is right, the same remedy will also affect the disease you are treating. If it is a frank psychotic case, safely avoid the soric rubric. If it is a frank syphilitic case, safely avoid the soric or psychotic rubric. So this is what tips by Dr. Vijayakar sir, that if you are treating the case and then you have to avoid certain things. So this is what we conclude here our today's sessions, so that we can learn. So from this we have to understand even genetic disorders can be treated with a dispositional trait of the patient. So disposition is the most important in treating each and every patient, and it is also the wisdom of Master Hahnemann telling us in aphorism from 210 to 230. He also gives more emphasis on the dispositions when you are treating the disease, and disposition help you to find it is helping you in the cheap selections of the remedy. So here you can think that even a genetic disorders like a DMD also be treated with the dispositional point of view if you understood the miasm in a proper way. So hope you all enjoy learning and you have a great thought provoking, so that it will help you in your practice. So practice like this and that will help you in your improving your cases. So there is one or two question I think. Yeah, it was mostly sir using a Kara software and sir using a complete repertory for the studying the rubric. So it will help you to understand the repertory or help you to understand the remedy from the repertorial point of view. When the child come with the psychotic trait and the disease, with the mother having a strong psychosis also while treating the child, how much is the mother psychosis symptom to be considered? Uh, can you elaborate more for this, Dr. Nisha? Mostly the psychotic trait comes in a child is the adaptations that the mother having some sensitivity got hurt, and that sensitivity got hurt, and that is the adaptations came into the child. So you should not be like me. So I am weak, so you should become a strong. So exactly the opposite nature of the mother sensitivity the child has developed. No, mother psychosis should not be considered. Mother sora and mother sensitivity should be considered, because when you came across the mother psychosis, so that means again a discipline. So you have to treat the sora. For delusion, you have to understand the sensitivity. Then sensitivity goes into insecurity, and that insecurity goes into a psychosis, a big psychosis, and then that insecurity goes out of control, goes into perception of the mother. So that will help you to understand the delusion. But you need to prove that what was the sensitivity mother going through and what was the sensitivity get hurt when the mother having a circumstances, and what was the mother's reaction. Right now the Kara software is not available, so it was an updated version of the Kara. It is a Vision or IC software you can purchase from Dr. Praveen Jain. Praveen Jain is the Indian distributors for Vision software. You can purchase from them. Patient having diabetes and GB stone, which one should be treated first? Apply your knowledge of suppressions and knowledge of miasm. So diabetes, which layer? And GB stone, which layer? Yes, you can get the number of Dr. Praveen Jain. Yes, for ISIS. So Dr. Arika, you can get number of Dr. Praveen Jain for ISIS. Great. Yes, diabetes is the fifth layer disease, not the sixth layer disease. GB stone is the endodermal accumulative, so it is the third layer, second layer disorders. So fifth layer has to be given more important than the second layer. So that has to, and the GB stone is accumulative pathology, diabetes. There are three type of diabetes: the psoriatic diabetes, psychotic diabetes, and syphilitic diabetes. A long-standing diabetes is a psychotic diabetes. Recent origins is a psoriatic diabetes, or sometimes it is a destructions or insulin getting destroyed. So it is a syphilitic type 1 diabetes. After allopathic treatment for alopecia child has come for the right knee weakness and the limping with the calf muscles pain. How to approach? Again, you need to treat the syphilis. It is something that the syphilis has been suppressed and syphilis going into destruction. So you treat the syphilis, take a whole case and prescribe GCS. Simple. Everything is simple. There is no different approach. I have shared all the approach in the YouTube video lecture playlist. So go through that so that you can get idea. But in all that, we need to find out the genetic constitutional simillimum of the patient. So most of time, this is the idea to get the result in every case. Do not treat disease, treat the man in disease. So why this child developed this? Find out that why and treat that. Hope you got it. This is the syphilis. Destructions. The limping means the balance is gone. The calf muscles pain is the sora. But you have to go through the case that he might develop some of the problem. So this is what alopecia in child. Alopecia is autoimmune syphilis. Again, the limping and calf muscles and weakness, that is something that is related to a genetic mutation. So go for investigation of the patient first, and then you need to treat that. It is not just a pain to treat. Okay. So hope we conclude this day today. We will continue our journey tomorrow and Saturday, then on the Monday. So Sunday we will have a off. Thank you all. Thank you. Thank you so much. So we conclude the day today. Thank you. Thank you so much.